And welcome back to the Wellness Paradox podcast. I'm so grateful that you joined us on this journey towards greater human flourishing. As always, I'm your host, Michael Stack, an exercise physiologist by training and a health entrepreneur and a health educator by trade. And I'm fascinated by a phenomena I call the wellness paradox. This paradox, as I view it, is the trust, interaction, and communication gap that exists between fitness professionals and our medical community. This podcast is all about closing off that gap by disseminating the latest, most evidence-based, and most engaging information in the health sciences. And to do that in episode 103, we're joined by Sharon Burke. Now, Sharon is a medical exercise specialist. So this conversation is going to tee up something that is very near and dear to the heart of the wellness paradox. In fact, as we'll talk about in this conversation, Sharon has literally been bridging the gap that is the wellness paradox for the past 20 years. Now she's not only doing it through the lens of connecting with physicians and working with the chronically diseased population, but through her Life Energy Foundation, she's also bringing in the health equity component. We're going to touch briefly on that health equity component, but this is largely going to be a conversation around best practices to work with the chronically diseased and comorbid population. Any information we'd like to share with you from today's episode can be found in the show notes page. That's by going to wellnessparadoxpod.com/episode 103. Please enjoy this conversation with Sharon Burke. Today, we're delighted to be joined by Sharon Burke. Sharon, thank you so much for joining us.
My pleasure.
So this is a very exciting conversation we're going to have today, although I will tell you as we start, I'm very jealous because you are in Hawaii right now, and I'm here in Michigan, although Michigan's not that bad right now in the summer, but Hawaii is Hawaii, so thank you for pulling yourself away from the beach to have a chat with our audience.
Well, that's on the docket later this afternoon.
as it should be. Well, you and I originally connected at the ACSM Health Fitness Summit, I believe it was, and we had a really good conversation, and I found out a little bit more about the great work you're doing, and I thought it would be great to highlight it for our audience here on the podcast. So before we actually get into our topic today, why don't you start by telling us a little bit more about you and your background?
So I am what they call a medical exercise specialist, which is dealing mainly with medical type conditions, chronic conditions, and obviously using exercise to prevent, help, post-rehab people. A lot of it has to do with those with comorbidities because they aren't so easily, sore knees, that's something a trainer could do. But now if you throw in osteoarthritis, RA, and maybe diabetes, that's a little more challenging. So those are the type of clients I work with. Age-wise, chronic conditions don't seem to be tied into one age group. So I've had children as young as 12 with hypermobility and EDS to 94-year-olds that just want to be able to put their socks on again. So that's, and I spent, 30 years doing it and acquiring this, what I think Mike Boyle was the first one, the LBMA degree, learned by messing about, because we didn't have back in the mid 90s a blueprint that now exists, which is awesome.
Yeah, absolutely. And this is why this conversation is so intriguing for our audience, because this is, we are a group of practitioners that listen to this podcast because we want to work with that chronically diseased population. And to your point, we do know a lot more about it now. Now, the other thing I found interesting is the Life Energy Foundation, this organization that you started. So this is not just a conversation around chronic disease that we're going to have here, but there's also a bit of a health equity element to this. So tell everyone a little bit about the Life Energy Foundation, what its mission is, and who it serves.
So I found notes back in like 2002, over 20 years or 10 years ago. Or is it 20 years ago? Yeah, 20 years ago.
20. Time flies, huh?
I started getting approached by people who obviously couldn't approach, back then trainers were, just very wealthy people could afford it on top of the nice gyms we all worked in. And so people were, I would go give free presentations because I really believe and was very moved by how much exercise and movement and just sort of non-pharmaceutical tools can really make an impact. And then it started to grow on me. Well, obviously not everybody can afford it. It's great affording my services, but how can we start bringing this information to people who can't? And then as numbers started moving up, our diabetes and hypertension, and we know that they affect the Hispanics and the African-American community much more than others. It started like, how do I bring that to them? Because now that's multifaceted. You've got social cultures, you've got the ability to pay, and you have time constraints and equipment and, just many. So this has been percolating slowly. And then when the pandemic hit, I actually had to cut back, and my daughter had her first high-risk twins. I had to literally clear my plate to be with her. And I thought, well, I don't need to go back to work, thank gosh, by, making money. I can actually start this. And so applied for my 501c3. And then I just start blogging and doing presentations for free in order to, to bring this to those specific demographics, because, we really have to hit everybody, not just the wealthy or the fit. We have to really address this because it's becoming such an astronomical health cost for everybody.
Yeah, and I'm so happy to hear that was something that you realized, because I feel like more fitness professionals can really benefit from realizing and doing something about the health equity component. I mean, we've talked about health equity on the podcast before, and the fact that your zip code has about as much to do with how long you live as your genetic code is a really sad commentary on society. So it's commendable that you started it, because to your point, the populations that can least afford fitness professional services are the ones that in many cases need it the most.
Yeah. And the other thing I listened to also on a great, I think it was a podcast, was all about how the stress because of the socioeconomic and the disparity and the racism affects these. That also leads to actual creating the diabetes, the Alzheimer's, and the hypertension. So just living their life automatically in these situations starts to put them on that downward spiral to getting these diseases.
Yeah, absolutely. And so it's rewarding work we do in general when we work with the chronically diseased population, but, particularly the population that has those, that lower socioeconomic status. And that's a whole conversation in and of itself that I feel like we could get into, but that's not where the direction I want to take this conversation. This conversation, I want to really dive into your years and years of expertise as a medical exercise specialist. And first, just the general question of what role do you feel like fitness professionals can play in treating and preventing chronic disease?
Well, that is an awesome question, because I think that we are specially, I guess, suited and almost like the missing puzzle between, preventing, like true prevention, and even in that, maintenance start as well. Once somebody has it, like before they start just that downward spiral, we're the key. We are the key to making the biggest impact out of everybody. I mean, we see our clients usually for an hour, 30 minutes, but weekly. That's a lot of like tracking we can do as to what they're doing. That's a lot of coaching and checking in. I mean, I'm always, when I'm working one-on-one with the client, was like, so how was your week? What was your goal? Is there anything I should know? But like, did your doctor say anything? If I have a good relationship with the doctor, then I know what the doctor told them. And I'm going, so how are you with your medications? Are you getting those? Whatever that, like, I want to say, follow-up that needs to do, we can do it. And we can then report, like be that liaison as to maybe something is too much for that client to handle right now, and maybe some other alternatives we could suggest, because we have a lot more time to get to know them. And And theirs, as we all know, behavior modification is the toughest thing. Doctors roll their eyes at it, like we can't get people to be compliant. Well, that's what we do.
Yeah, I think what's interesting, the point you bring up there is so important because any healthcare provider has such a limited amount of time to spend with their patient. And the reality is, in many cases, they would like to spend more time, but structurally, the system constrains them from doing that. So, if you are seeing someone for 30 minutes or 60 minutes once a week, that could be the amount of time that they spend with their healthcare provider in 6 months or a year. And to your point, behavior modification can't happen in a hurried 10 to 15-minute appointment.
Yeah, I so agree with that. And I've seen it even when I'm part of that continuum of healthcare. I've seen much bigger strides. Another reason why the foundation became so important is because I would see how much progress somebody would make. Like, I had a client in a wheelchair and his wife, no help to transfer him. He's like 6'2", and granted, he didn't weigh a lot, but 6'2", even, not weighing a lot, still weighs a lot for it. I think she was 79 at the time. I mean, she was strong, but, just the ability to give him strength in his legs and his arms to help with that transfer was monumental to the quality of their lives. And that's really what we look at the foundation, is the quality of somebody's life. How do we bring tools and resources to make that better?
I think that's a great way to frame it up too. I think typically in the medical model, we're looking at on a clinical basis relative to disease, which is certainly important, and that's the level that medicine operates on. But as fitness professionals with kind of a less restrictive scope of practice, if you will, we look at overall quality of life, and I think that's a great way to frame it.
Yeah, and we also that the medical model is, my daughter-in-law is a physician's assistant, and she has like 2,000 clients to keep track of.
Yeah.
And I'm like, well, how do you do all that? And I see her pulling her hair out because she literally, and they're all in this demographic, because she works for the state of Pennsylvania. So they come under that healthcare, and the amount of time that she goes over and above to find people solutions that meet their financial budget, God bless her. It's probably why I love her. But this is where we fit in. Again, back to that key. We have that time. We have this ability to help be sort of that bridge to the gap to making a difference and progressing, and even affecting healthcare costs in people's lives. We are perfect fit.
You mentioned earlier relationships with physicians, and having good relationships with physicians. Talk on that for a moment, because I feel like that's such an important part of this process, but it's also so fraught and challenging for many fitness professionals. Tell us a little bit about how you've fostered those trusted connections with physicians.
Well, I think one of the things you talked about in your presentation at ACSM was the fact that it could take a year. And that really, I think in this culture right now, everything being immediate, you really have to visit that again. It can take a year. There are some that will just not give you the time of day. There are others that it's almost like a either or, that will jump on your reaching out and saying, oh my gosh, here. And you also pointed out that it only takes one or two before referrals start coming, and you're so correct. So I've had physicians basically tell me to mind my own business. And then I've had others, and there's where you keep pursuing it, because I've had others that were very thankful that I was working with their clients, that I sent, like, example was, I noticed a woman who I knew because I took a health history on her, was wheezing as we were doing intervals on the cross trainer. And I thought, well, she's never done that before. So I did. I go into your doctor, because you have a history of smoking, and get this checked out, please, because it doesn't sound good. And don't tell her your personal trainer, because at that time I wasn't a medical exercise specialist, sent you. Well, she went in there and she told her anyway, but I got a very nice note from the doctor saying, yes, anytime you have a concern, please refer Hope back to me. In this case, we took an x-ray of her lungs. Everything is good. It just happened to be some allergies or a reaction to the pollen in the air. But, sometimes it's not. Sometimes in another case with a client, it's 3 lesions on their back that they couldn't do their ab exercises properly and had a history of cancer. And I said, no, I think you should go in and talk to your doctor because you're doing everything properly. You should be getting better. You need to go in. And unfortunately, that one didn't have as a nice, there's the downside of working in this market, is you do actually lose your clients, and it's sad.
I'd like to take a quick break from today's episode to tell you a little something about one of our sponsors. As all of you are well aware, addressing the wellness paradox is a lifelong passion project for me. And when you're going to go on a long journey, it's difficult to go it alone. You need to find like-minded individuals that are willing to go on that crusade with you. And that's exactly what I found at the MRF Institute. The team over at the MRF Institute creates educational content for fitness and wellness professionals who are serious about becoming a part of our healthcare continuum. Getting on the healthcare continuum is all about leveling up our skills to be looked at as that valued resource provider. The wellness paradox is certainly an avenue for you to do that, but we need many different levers to pull if we're going to get there. And the MRF Institute is definitely one of those levers. You can go to their website, mrfinstitute.org, to find all kinds of great, informative, free informational content. And if you choose to engage with any of their paid content, they've created a coupon code specifically for Wellness Paradox listeners. You can enter in WP 2022, that's WP, and then the number 2022 to the website at checkout to receive a 15% discount on your purchase. I highly recommend you go check out mrfinstitute.org. Now back to today's episode. The one thing I think that shouldn't get lost in what you said there, which is so important, is in a lot of cases, fitness professionals are that front line because they see their clients so frequently. And there's a lot of people that, quite frankly, avoid medical care for any number of reasons. They don't want to pay for it. Ignorance is bliss. They're afraid of what they're going to hear. And the fact that you were there and you could pay attention to those symptoms and at the very least make the client aware of them. You're not going to force them to go to the physician, but you're at least going to create that awareness. I think that's so powerful.
Yeah. Sometimes I do make them go. I do force them.
That's good. Yes. Sometimes they do need the push.
That's my, sorry, we're not trained until you talk to your doctor.
Yes. Yeah. Which is very appropriate and actually a great segue into best practices. And you mentioned you're a medical exercise specialist, so this is an area that you're specifically trained in. And I realize we could probably spend an hour talking about any one best practice to working with this chronically diseased population. But if there are a couple of best practices in particular that you wanted to impart on our audience for working with the chronically diseased population, what would those be?
Well, I just gave a talk on forms, not form. But one of them is to get a good, I love the PAR-Q extended health history. I believe Canada came up with it. It really classifies and has a lot of wording in there that is very important, both for the trainer and the person filling it out, because I won't work with somebody unless they fill that out, because it screens them for me. I know exactly when to refer to their doctor and when there's the gray room, which a lot of trainers who think they, and I was one of them at one time, know everything, I've got it, and then learned the opposite. So it's a great screening tool. And then the other one is just a head to toe health history. Because that way you know what you're dealing with and whether you want to work with them or not. So you really have to have that in your mind as to what, I will only work with cardiac patients if I have a history with them. I don't want a newbie. It's just too scary for me. I don't want to deal with a heart attack. So there's where I know my limits. Know your limits, know your scope of practice, know your education. Education is huge. That you are well equipped with the knowledge to deal with what could eventually happen to this person that you're going to work with. There's a lot of trainers, unfortunately, out there that think that they can, do everything, like they can handle everything. I would disagree. I stick to certain areas and I learn that area really well, and then I will take on another area. I get excited when I get a new client, because to me, that's like, ooh, lots of homework and lots of new learning about a condition.
Stay with that education piece for a moment. This is an area that's certainly built up over time, but it's not as if the education for medical exercise is as extensive as it is for just the general able-bodied fit population. Where are you going for your resources for education?
I'm super picky because I had to learn it all on, like, I started with PTs. So if you can start with PTs and or the organizations that cater to the condition you're looking for. I used to have to call up. I would go directly to, like, there's a condition called sporadic ataxia, and I'd never heard of it before. So I just went and called them up and said, where would you, be in, where would I get this information? So, chronic fatigue, Ehlers-Danlos, these are kind of what they call the zebra, but MS has a certification, or it used to have a certification that you could get through the MS Society. Every society foundation of these conditions has a website, and I usually start there. And then I try to find a doctor who will talk to me. It's harder these days, much harder these days, because doctors are overworked. But even if you know of somebody, start with the client and, start just pestering them with questions. And then there's where I have an advisory board. So I do have doctors at this point, PTs, nutritionists that I have built up over the years. So that's the other, what I call your A team. Build your A team so that when you have these things or you don't know what to do, you have somebody to ask. It's extremely important. And then really research where you're getting your education from. There's many different sites, and I'm not going to pass judgment on them, but I do really review the what they list, what the course encompass, how long, and if possible, I even call them and ask questions. Sit in on webinars, because most of them give free webinars to advertise some of the education that they want you to buy the course. That's the best place to go, and ask them if they're not very, I want to say, robust in their answers back, then maybe the quality of the course is also a little bit more generic. And depending on what you're looking for, you may choose elsewhere, or that may be where your starting point is.
I love the idea of the advisory board. I think that's such a great tip and best practice for our audience. It reminds me, in the medical fitness model, where you have a medical fitness center that has a medical director and a medical advisory board. You've done that, but without the brick and mortar medical fitness center. And I think that goes back to something we were talking about earlier with regard to just the relationships that you've developed with not just physicians, it sounds like, but also a myriad of other allied health professionals, physical therapists and the like.
Yeah, even communities. Like, so if you're wanting to deal with the senior community, there's so many there's continuing care communities that offer, you could do presentations, reaching out into that. Most every disease has a foundation, a society, or some nonprofit associated with it that you can then reach out. And some of the best information I've got was like on an MS symposium. And I applied even to, ACE for continuing education credit, and I got it. And now you're connecting with the doctor, because they are getting their CMEs there. And so it's a great place to meet those. Or functional medicine has its conferences, so maybe you go up the food chain a bit is what we would in our fitness, but be comfortable in stepping out of your zone and going other places. The National Council on Aging has conferences. Again, that goes back to know where you want to have the impact and who your clients you're going to work with are.
That's great. And I bet at those conferences, you're one of the few fitness professionals that's actually there, which means that you stand out and have a great opportunity to network.
Yeah. A little more expensive, but they give you food. That's what I like about it.
They do. It's probably in nicer places. There's all these advantages, but the cost is definitely there. You're probably not going to Las Vegas in the middle of July for a physicians conference. So what is the biggest challenge that you face in doing what you do?
Right now, the bigger challenge is getting out there. Actually, ironically, is finding the participants. Really, I'm finding that the societies are very busy now. And so trying to set up for me as a foundation, making that connection to a community that will actually let me come in and do my programs, because one of the near and dear things that I love doing, we talked about education and scope of practice, is to try to get plug and play protocols, systematic exercise programs out there that are plug and play. You don't need you need a general knowledge, and then you follow, the formula, and we consistently see results, because I feel that is the answer to hit the socioeconomic challenged communities, because we can't do all the one-on-one. Mm-hmm. So that's my challenge right now is, number one, getting funding, but number two is getting out there to get people to participate so we can have the data. And I just sat in on a conference last week and found out that Medicare and Medicaid actually opened up some new coding for chronic pain management. So that's very exciting, if, to be able to approach them with data that says, look, if people come into this program, they're going to improve, and you should cover at least a portion of the cost. So keeping fingers crossed, just there's that pounding the pavement and keeping at it is very challenging. And then I hate to say it, but professionals that actually want to do the work and learn this. Mm-hmm. It's unfortunately, we are at a point, I feel, in our profession where people want to get paid $125. And I don't think the economy is going to quite be able to handle that long term. Yes, at the top, yes, the wealthy, but not anybody sort of in the third, fourth, fifth tier down, maybe even in the second tier, depending on where they want to, how extended they are.
I'm very happy you mentioned the importance of outcomes, because I think that that's something that we've really lacked as an industry nearly since our outset. And we're not just talking about how somebody looks in their bathing suit on the beach. We're talking about the health outcomes. We're talking about improvements in A1C, improvements in VO2 max, improvements in muscular strength, improvements in mental health. The idea that we can stand up programs like you're talking about that are replicable, they're reliable, and they're consistently producing outcomes, that's what gets us across the finish line to reimbursement, is having more of those programs out there. So it's good that you're hearing that Medicare and Medicaid is willing to start to reimburse for some of these things. But if that's ever going to be reality, we do need the professionals that are going to do the work to actually show the consistent reproducible outcomes.
Yes, that's definitely true. And that goes back to, like you're saying, is to have proven outcomes. Well, then we have to have assessments, pre and post, and there has to be, a log of things. And I believe that is another key to getting reimbursed, but also for physician relationships, for any relationships you want to build in this medical community. They love their paperwork. But you do need to have what you're doing when with the client, somehow a trail. And also another thing is, I usually include in some of my paperwork when I'm working with the client is, like, if such and such happens, I am going to immediately refer them back to you. so that the physician knows already that I know what the red flags are. I know what the red flags for this client or condition is, and I'm not going to push limits, because I do know trust has been, especially as you mentioned with the pre-post photos, it's been such a big thing in our industry for so long that I think the medical community is seeing, and a lot of our, Instagrams, TikTok, Facebook, websites and things is very geared toward that. And like 80% of our population does not fit into that box.
Yeah, well said. I just read a article a couple weeks ago that looked at fitfluencers on social media. Apparently that's what they're calling them now. And the scary statistic was that over 60% of the information that quote unquote fitfluencers were peddling on social media was, at worst, somewhat inaccurate, but at best somewhat inaccurate, at worst harmful. And so I think it is very interesting how our credibility has been challenged, but we can fight that with outcomes, and we can fight them, doing the good work that you and many other people in the community are doing. We just have to make the broader medical community more aware of it.
Yeah. And that goes back to what you were talking with the education piece and the relationship building. Take it slow, be very patient, because it is important that they trust you. Once you get the trust, then things tend to, open up, and you can have the conversation is how best to provide services and support to the physician. I know sometimes too, there's a lot of bashing of physicians because we don't agree with what they're doing, or we see things from a different lens with the client. And that has butted heads in our industry. Nobody wants somebody to come in and say you're wrong, especially when they haven't gone to medical school. So one of the things when I wrote a course for MedFit was be very, very respectful. Like, we did not go to 8 years of school, depending on if it's a specialist or not. And sometimes my daughter, who's an emergency veterinarian, not a person, but has opened the eyes to the fact that managing a condition that, yes, there may be other options, but for this patient is the best, than trying to make something better.
Yeah.
Personally, I have experienced that because I have PVCs, and ironically, the fitter and the more relaxed I get, the worse they get. But and I also have very low blood pressure. So, but giving me high blood pressure could probably kill me. So probably not the best answer is to medicate me or go with something else or do something else. It's best to just monitor my condition, which isn't fun for me, but probably best. So
yeah, there's the complexity. And I think, being humble and curious and willing to learn is so important. Sharon, where can people go if they want to find out more about the great work that you're doing?
So they can go to my website, thelifeenergyfoundation.org, www, all lowercase and all one word. My contact details are there. Easy to get in touch with me. I'm always looking for collaboration because I am sort of the only one due to funding that is sort of running things, but I definitely have done some great collaboration on just the creation of some of our programs, because we have several, and the implementation of some. And it's kind of exciting. That's I love to create something that works. It's, watching somebody who, couldn't do something, then all of a sudden they can. Or they were in pain and now they're not. That is why I do what I do.
Yeah, well said. I think that's a lot of why we all do what we do. And we're going to link up to your website on the show notes page so our audience has a chance to interact. And that was the reason we started interacting, is I was just fascinated by what you did, and looking for opportunities to collaborate, and hopefully beyond the podcast we have that opportunity to do that in the future. Those of us that are thinking from this perspective as fitness professionals, I think it's so important that we collaborate, because there are a number of us out there, fewer than I think what both you and I would want, but those of us that are out there, we do need to work together to make sure we're all rowing the boat in the same direction.
And I think that is like the biggest key is that, somebody asked me like, well, if you refer out or you do something with somebody, aren't you losing out? Myself? Well, number one, I don't work for money. So no, I don't. But when I did, it was like, no, I really feel like we don't even have a quarter of what we need.
Yeah.
And if we all were busy from now until the time we were all ready to retire, some a little bit earlier than later, we'd all be super busy.
Yeah.
Like it is, we talk about the big blue ocean, but you know what? Having been a swimmer all my life, you have to learn how to swim in it.
Yeah.
Or it will tear you apart.
Well said. Well said. Well, before we end the conversation, I'm very excited to ask this last question to you because you've actually been bridging this wellness paradox gap. But the question I always end the show on is the wellness paradox is this gap that clearly exists in trust and communication and collaboration between fitness professionals and the medical community. Based on all of your years' experience of bridging that gap, what would be the one piece of advice you could give fitness professionals to help do so?
Probably plan of attack, a strategic plan. I have to say that my husband made me put a business plan together before I opened my brick and mortar. Mm-hmm. And it was the most excruciating, painful, because in our profession, we're all like, just do it, right? Nike, just do it. And it was hard, but it was the best thing because when I had that, even though it didn't stay the same, I knew what I needed to do. I knew where I needed to focus. And then that was easier to plan an attack or a guide. I do the same thing with clients, right? We have to have a goal. We have to find what you're willing to do. And then we can form a solution. But without that, and that's another thing about your company, that bridging of the gap and providing these podcasts, education, more of this needs to happen. And we all have to be, play in the same big blue ocean together.
Awesome. I couldn't agree more. Have a plan. Sharon Burke, thank you so much for joining us on the Wellness Paradox.
Thank you. It's such a pleasure to be here.
Well, I hope you enjoyed that conversation with Sharon as much as I did. If you found it insightful and informative, please share with your friends and colleagues. Those shares make a big difference for us. Any information we'd like to share with you from today's episode can be found on the show notes page by going to wellnessparadoxpod.com/episode 103. Please be on the lookout for our next episode when it drops in 2 weeks. And don't forget to subscribe through your favorite podcast platform. Until we chat again next, please be well